I'm Antonio Facciorusso, Assistant Professor of Gastroenterology at University of Foggia, Italy. Today I will present our recent study just published in Endoscopy, Predictors of Adverse Events after Endoscopic Ultrasound through the Needle Biopsy of Pancreatic Cysts, a recursive partitioning analysis. Preoperative accurate assessment of pancreatic cystic lesions is of paramount importance for adequate patient's management. Simple morphological characterization is not sufficient to define the exact diagnosis and stratify risk of malignancy. Recently, given the disappointing results of endoscopic ultrasound fine needle aspiration in this field, a microforceps able to pass through a standard 19-gauge FNA needle has been developed to perform a biopsy of the cystic wall, the so-called through-the-needle biopsy. Several studies and meta-analyses confirm through-the-needle biopsy with high diagnostic sensitivity and accuracy compared to FNA. However, some safety concerns were recently raised because a non-negligible rate of moderate to severe adverse events was observed. Therefore, adverse events risk stratification is mandatory to optimize the risk-benefit ratio of this technique. In the current study, we aim to generate a prognostic model for post-through-the-needle biopsy adverse event risk using recursive partitioning analysis. In order to assess and rank the relevance of each predictor variable, we estimated random forest variable importance measures through permutation of these variables. The predictor variables were then tested by a recursive partitioning analysis, a statistical tool that classifies patients in risk groups by means of trees aimed at correctly classifying members of the population based on several independent variables. The model was internally validated using bootstrap resampling with 1,000 repetitions. Data of 506 patients were analyzed. Recursive partitioning analysis of prognostic factors demonstrated that the risk of adverse event occurrence was stratified based on diagnosis of IPMN, complete aspiration of the cyst, number of microforceps passes, and age. The presence of these factors split the whole series into three classes: high risk IPMN sample with multiple microforceps passes, 28% of adverse event rate; low risk, only 1.4% adverse event rate, including patients below 64 years with other than IPMN diagnosis and sample with up to 2 microforceps passes and with complete aspiration of the cyst; and middle risk class, 6.1% adverse event rate, including the remaining patients. Not only the adverse event rate, but also the severity of the events was significantly different among these three classes. The model showed good calibration and validation with high accuracy. In conclusion, in spite of the retrospective nature of our study and the lack of external validation, we demonstrated that through-the-needle biopsy should be avoided in patients with presumed IPMN due to the high risk of complication, whereas it seems safe in patients below 64 years with pancreatic cystic lesion not in communication with the main pancreatic duct, sampled with 2 microforceps passes and completely aspirated. Older patients have intermediate risk, thus the risk-benefit of the procedure should be carefully appraised in a multidisciplinary setting.